Yes, women who are pregnant can and should receive the vaccine. In terms of pregnancy and COVID-19, there is no question that pregnant women are at greater risk than non-pregnant women from this disease. We have good data from a very large study, over 400,000 women, of whom tens of thousands were pregnant. More than 20,000 women were pregnant. That data shows that if you get symptomatic COVID-19 and you're pregnant, you've got a 70% higher risk of dying, and you have a significantly higher risk of getting into an ICU. And so I think that this is really important information for pregnant women to understand. There are these theoretical risks that have been raised, none of which have been shown, and there are very real risks from getting the disease that we know. It's not a matter of a theoretical risk. We know that pregnant women are at greater risk of dying and getting really sick if they get COVID-19. So this is the reason why we are recommending that the vaccination be given to pregnant women, recently pregnant women, lactating women, that it is safe for them to have it, and there are no data that are out there that suggest that this vaccine causes problems in pregnancy. After a discussion with their healthcare provider, and it's important that you have a discussion, that women contemplating pregnancy can have the vaccine. The recommendation is that you can, but that you have a discussion and with your healthcare provider about any theoretical risks that may exist. Again, with the RNA vaccines that we have, there is no evidence to suggest that this causes fetal anomalies or interferes with the ability to get pregnant or any of the treatments. We simply do not have data that suggests this, although our data are limited. We must obviously not suggest that we have incontrovertible data, but we have limited data that suggests that there is no risk.
The American Society of Reproductive Medicine has actually issued a statement on this, that since this is not a live virus, it cannot cause you to get the COVID-19 infection, nor does it enter your cells and interfere with your individual's DNA. It has not been associated with any kind of increased risk of miscarriage, inability to become pregnant, or potential fetal birth defects or stillbirths. With regards to infertility, I know that there's been some information out there in the social media platforms that have sort of suggested that it could cause some issues of infertility. And what has been claimed on the social media platforms incorrectly is that the type of vaccine is against the SARS spike proteins is very similar to proteins in the placenta. And what they're alleging is that by getting this COVID-19 vaccine, then you'll develop antibodies that will, in fact, attack your placenta. But immunology experts from around the world have totally said this is not possible. But I think now we're already up to about 25 million individuals being immunized in this country. There have been, as I don't know an exact number, but it's been reported to be several thousands of both pregnant women, women who are currently breastfeeding, and women wanting to get pregnant. And we have, again, not seen any sorts of effects. The American College of Obstetricians and Gynecologists states that individuals that are lactating should not be denied access to this vaccine. And in fact, we shouldn't treat them any differently than someone who's not breastfeeding. American Academy of Breastfeeding Medicine also states that this should be allowed. In the theoretical possibility that some of this vaccine could even get into an individual's bloodstream and then get into the breast tissue and ultimately into the infant's digestive system, it would be gone shortly thereafter. And so lactating women should be allowed to have access to the vaccine because their risk is just like everybody else's in the population.
Pregnant women who are symptomatic with COVID are at high risk. The CDC recently published data that shows that pregnant women with COVID symptoms are at higher risk for hospitalization, they're at higher risk for being put in the intensive care unit, they're at higher risk for needing to be on a ventilator, and unfortunately, they're also at higher risk for dying. There are subtle changes in our bodies that are associated with pregnancy that may increase our risk for infections, like COVID. There are shifts in the immune system that happen during pregnancy that can increase our risk. There are also changes in our cardiovascular system and our pulmonary system that make us more susceptible to the complications from viral infections. In the H1N1 pandemic in 2009, we also saw that pregnant women were severely affected by this infection. They were more likely than their non-pregnant counterparts to experience the complications, hospitalizations, admission to the intensive care unit, mechanical ventilation, and death. Right now, we don't have enough data to address the long-term effects of COVID for pregnant women. We'll need additional studies to better understand that. What we've seen among non-pregnant people is persistence of fatigue, of headaches, and other symptoms. But we'll need to follow that to better understand what happens for pregnant women.
I wanted to protect other people, and I wanted to protect myself and my family. And this is the way to do it. I could not be more strong in my recommendation that everybody at Texas Children's get vaccinated. This is the only way we're going to beat this scourge. It's not going away soon. This is not something that's just going to vanish overnight. This is something that is going to require each and every one of us to put in our bit to protect other people and to protect ourselves. And so please get vaccinated. What I would say to a colleague hesitant to take this vaccine is, please tell me why. Tell me why you're concerned, and let's talk about those concerns. Now, there are valid concerns, and then there are concerns that are rooted in conspiracy theory. Other concerns about the vaccine making people very sick and this sort of thing can be addressed with data. And at the end of the day, we should use science to answer these questions. And I think that most people, once they understand how they can protect their family and they can protect themselves, will take the vaccination. And that's what we're trying to do. We're trying to convince people at Texas Children's and in the general public that this vaccine is safe and that it should be done in order to protect everybody.
The vaccine gives us an opportunity to end this pandemic. Getting the vaccine is a small step that each one of us can take to help us stop this pandemic and return to a much more stable economy with opportunities, and to return to all of our social connections that are the very fabric of our lives.